Hello, my name is Donna Ockenden. As you know, I'm the chair of the Independent Review of Maternity Services at the Shrewsbury and Telford Hospital NHS Trust. I know that across the country we welcome the gradual return to normal life, and it's good to see that lockdown restrictions are lifting and we're able to meet our families and friends again. This has been such a challenging time for us all, and I hope you and your families have remained safe and well during these difficult months. My message to you today is to update you on the progress of the maternity review and any changes taking place in maternity services across England as a direct result of our first report published last December. Trusts in England have started work towards implementing the immediate and essential actions outlined in our first report, with NHS England and Improvement monitoring their progress. An example of this is the Shrewsbury and Telford Hospital NHS Trust's Ockenden Assurance Committee, which I spoke about in my last update. This committee meets monthly and then reports to the Trust's Board of Directors to update on their progress against the 27 local actions for learning and 7 immediate and essential actions. Their next meeting will be on 27th of May, and we will send you details on how you can watch the meeting if you wish to watch it online. We've seen many other examples of actions as a result of our work from trusts across England, and here is one from the Royal Devon and Exeter Hospital. You will see in this example the work from RD&E across the 7 immediate and essential actions. These posters are found throughout the maternity department in Exeter, and is one of the ways that the senior team there are communicating to on-the-ground staff and women and families what they are doing in response to the first report, your report. Since I updated you in March, work within my team continues. We've recruited additional obstetricians and neonatologists and are in the process of recruiting more midwives. The team now consists of doctors and midwives who work within 25 different trusts across England, from Leeds to Plymouth. With the further easing of the lockdown restrictions, I'll be travelling once again to Shrewsbury to hold private face-to-face meetings with families. The first of these visits will take place from the 24th of May. If you have information that you would like to share with us about your case or have any questions, then please email us at maternityreview@donnaockenden.com. As always, your voices remain at the heart of this review. In March, I said we had written to a number of organisations to ask them to share information with us. These organisations may hold information about you that we would like to review as part of this ongoing review. We require your explicit consent in order for information from these organisations to be shared with us. On Tuesday, 1st of April, we sent you an email asking, do you consent to your details being shared with stakeholders, organisations? All you need to do is press yes or no on the voting button in the email. Thank you to those of you who have already replied. If you haven't yet responded, please reply using the voting button, which we will send to all after these update sessions. As always, if there's anything that you don't understand, please email us and we'll always try our best to help you. It is very important that staff voices are heard as part of our review. This is because it will really help with our understanding of what was happening in the maternity services at the Shrewsbury and Telford hospitals during the years that my team are reviewing. A questionnaire survey for both current and former members of staff who were employed to work directly in maternity services at the Trust was launched on the 11th of May. In addition, the CEO of the Trust, Louise Barnett, and myself have released a joint statement. I will also be recording a personal message to staff, encouraging their participation in the review. You may have seen some of the media coverage around our request for staff to come forward and share their views. It is important for the review team to reach as many current and former staff as possible. This is so they can share their experiences of what it was like to work in the Trust maternity service. This includes hearing from staff members such as doctors, midwives, anaesthetists, obstetricians, nurses, support workers, administrators, theatre staff, portering staff and managers. We may also have more detailed conversations with these staff members to help us fully understand whether there were any concerns raised at the time. We will of course ensure that individual staff who answer the survey are not identified in our next report. 2021 marked the 5th year since the publication of the National Maternity Review called Better Births. It also marked the culmination of the initial 5-year programme set out by NHS England and NHS Improvement's Maternity Transformation Programme. On the 30th of March, I spoke at the Better Births 5 Years On at a virtual event. This online conference outlined the progress made in maternity services across England to deliver safer care over the last 5 years in line with the vision of Better Births. The event was also an opportunity to hear from a range of senior leaders across the maternity system to discuss the future priorities for maternity transformation in England. This conference saw the launch of the NHS investing £95 million to improve safety in maternity services in England, which was announced as a direct result of the findings from our first report. This money will be used to increase the numbers of midwives and obstetricians within maternity services across England, as well as supporting and improving access for teams to multidisciplinary training. All trusts have now submitted their plans to bid for a share of the funding. This will make a real impact on improving safety for mothers and babies. The conference also introduced new plans for digital maternity records. The digital maternity care record will replace the paper records a pregnant woman has traditionally carried with her during her pregnancy. By having access to all the information available in one place, healthcare professionals will be able to provide more focused and individualised care and therefore improve the safety and experience for women and their families. We are now in the process of handing over the management of the Facebook group to the volunteers who've come forward to take over administration of this group. This will enable the Facebook group to be used as a support network for families for the duration of the review period. I want to thank the volunteers who've come forward to administer the Facebook page. I will talk about the next steps that the volunteers have taken in my update to you in July. Please be aware that I will make all updates about the review using our usual channels such as this update and the reviews and my own websites. If you are a family that needs support, please reach out. There are a range of charities that can provide help and advice. There is now more in-depth psychological support available via the Midlands Partnership NHS Trust, and you can ask for further information on this via support@donnaockenden.com. The Maternity Review Psychology Service is available from now until the summer of 2022, offering families who feel they would benefit from specialist psychological support access to consultations with chartered psychologists. The offer is currently open exclusively to families who are part of the review and involves an initial consultation with 2 psychologists for whoever in your family wishes to access it. Some families may want a standalone consultation, whilst for others there's the option of a course of psychological treatment. This can be for any family members affected by their experiences, for example, grandparents, couples or siblings. All families will have the chance to come back for up to 2 top-up consultations before the service closes next summer. An information sheet is available for families wishing to know more or who want to be referred to this service. I have also provided charity contact details on the review website at www.ockendenmaternityreview.org.uk or my own website at www.donnaockenden.com/support for families. You can of course contact the maternity review team during office hours between 8 and 4 Monday to Friday on 01243 786 993 or via email at maternityreview@donnaockenden.com.